Hi everyone, my name is Tony Mechrefe. I'm one of the orthopedic surgeons here at Ortho Rhode Island. I specialize in foot and ankle disorders. So pretty much any deformity, problem, issue from your mid-leg all the way down to your toes are problems that I take care of. Since we're all at home and doing a lot of activities at home, many people have been spending a lot of time barefoot. And people with flat foot problems tend to get aggravated when they've been spending a lot of time barefoot. And so I just wanted to share some thoughts about flat foot deformities, what they consist of, and kind of talk you through some ways while we're all locked down at home, how to deal with any issues that you may be developing with the painful flat foot. So basically, flat feet come into two different categories. There's the painful ones and the non-painful ones. And within that category, so within the painful ones, there's ones that are rigid and ones that are flexible, and the same thing with the non-painful ones that are rigid or flexible. Most people, I'll tell them, if your flat foot's not painful, there's really nothing you need to do. People ask me all the time, do I need to wear orthotics or not wear orthotics? I think really that has to do more with the patient's comfort. If you feel more comfortable in an orthotic, then I'm all for them. If you feel just as well without the orthotic, then I'd say go without the orthotic. When a flat foot is painful, that's when an orthotic can be helpful. And it can be helpful for both the flexible and the rigid flat feet. A flexible flat foot, so you know, do I have a rigid one? Do I have a flat that's flexible? How do I know the difference? I always tell patients, stand on the ground and raise yourself up on your toes. So I took my socks off, show you my feet there. So if you go up on your toes, and as you go up on your toes, you notice that your arch snaps up like that, then that is called a dynamic flexible flat foot. If you go up on your toes and your foot stays flat the whole way, then you do not have a dynamic flexible flat foot. You just have a rigid flat foot. What you do with the rigid one versus a non-rigid one really is dependent upon whether you're having pain or no pain. So very simply, if it's a non-painful flat foot, whether it's rigid or not rigid, just leave it alone. If it's a painful flat foot, rigid or non-rigid, then that's when we really like to initiate some kind of treatment. For the ones that are flexible, and those are the ones that when you go up on your toes, like I just demonstrated, your arch comes back, those are the type of flat feet that actually do pretty well with orthotics. And for a foot that's fairly normal shaped, I usually tell patients, just try to stick with a shoe that has a built-in arch support already designed in it. Like a sneaker, or a New Balance sneaker. Hoka is one of the newer brands that I really like. I think that tends to give the foot and arch a nice, good support. So when a flat foot is initially becoming painful, particularly if you're home now during this time, and you're spending a lot of time walking without any kind of supportive shoe wear, you may find that you're having a lot of pain on the inside of your ankle. If that's happening, wearing a shoe that has a good arch support can be helpful. Over-the-counter orthotics can be very helpful. Dr. Scholl's brand, there's Ortho Heels, there's dozens and dozens of different brands out there. That's really trial and error. If you feel like your foot shape doesn't really conform to some of the over-counter products, that's when getting set up with one of the orthotists or podiatrists that makes custom orthotics is ideal, because that orthotic will be designed specifically for your foot, give you the support you need, and give you some relief along the arch. For rigid flat feet, those certainly can be supported by an orthotic and give you some lift on the inner arch of the foot and give you some pain relief. Again, I always start with the simple stuff, the simple over-the-counter ones. For flat feet that are rigid, a full-length gel-type orthotic that gives you some extra cushioning can really go a long way. And of course, if the foot shape is such that the simple over-the-counter one doesn't fit well, then again, referral to one of the orthotists or podiatrists that makes custom orthotics really is the way to go. So that's a simple, assessment of flat foot deformities while we're all on lockdown and quarantine at home. So the take-home message really is that if it's not painful, whether it's rigid or flat or flexible flat, then you just do whatever you feel comfortable with. Whatever shoe wear feels comfortable, whether you're barefoot or not, there's really no difference in what you need to do. If the flat foot is painful, whether it's rigid or flexible, while you're at home, put some good supportive sneakers on to start. Give yourself a little support. If that works, you're good to go. If it doesn't, try simple over-the-counter orthotic. If that doesn't help, give us a call, come in, let us take an evaluation, see what your foot looks like, see if you'd be a candidate for something more substantial, such as a custom-made orthotic and or physical therapy or one of the other treatment modalities we can to treat this and get you back on your feet. Be well, everyone, and be safe.